Hello and welcome. Today we're diving deep into a fascinating and somewhat unusual urinary tract infection called emphysematous cystitis. It's a mouthful, I know, but stick with me and we'll unravel what it is, how it happens, and what can be done about it. So what exactly causes this condition? The primary culprits are bacteria, most notably E. coli, Klebsiella pneumonia, and Proteus mirabilis. These bacteria are gas-producing organisms, meaning they can ferment glucose and other substances in the urine to produce carbon dioxide and other gases. However, emphysematous cystitis is also known to occur in association with fungal infections caused by Candida species, and it is important to also consider non-infectious factors such as bladder ischemia. The most significant risk factor is poorly controlled diabetes mellitus, as the elevated glucose levels in the urine provide ample fuel for these gas-producing microbes. Other predisposing factors include female gender, advanced age, immunocompromised status, chronic urinary tract infections, urinary retention, and neurological disorders affecting bladder function. Alright, let's get a bit more technical and discuss the pathophysiology. In emphysematous cystitis, the gas-producing bacteria or fungi invade the bladder wall. The fermentation process then kicks in, leading to the formation of gas bubbles within the bladder wall and lumen. These gas bubbles can dissect through the bladder wall layers, causing inflammation and potential tissue damage. The presence of gas can also impair bladder function and, in severe cases, lead to complications like bladder rupture or systemic infection. The inflammatory response triggered by the infection and gas production further contributes to the symptoms. Now let's talk about how common this condition is. Emphysematous cystitis is considered a relatively rare urinary tract infection. However, it's more frequently observed in individuals with diabetes, particularly those with poor glycemic control. Due to the growing prevalence of diabetes worldwide and the aging population, the incidence of emphysematous cystitis is potentially increasing. It affects females more often than males. What are the telltale signs and symptoms? The symptoms can vary widely depending on the severity of the infection. Common symptoms include frequent urination, urgency, dysuria, painful urination, suprapubic pain, and hematuria, ebb blood in the urine. In some cases, patients may even pass gas through their urethra, a symptom called pneumaturia. If the infection becomes severe, patients might experience systemic symptoms like fever, chills, nausea, vomiting, and even septic shock. So, how do doctors diagnose emphysematous cystitis? The first step usually involves a thorough medical history and physical examination. A urine analysis is essential to identify the presence of bacteria, white blood cells, and glucose. However, the definitive diagnosis relies on imaging studies. Abdominal X-rays, CT scans, and ultrasounds can detect the presence of gas within the bladder wall and lumen. CT scans are generally considered the most sensitive imaging modality for diagnosing emphysematous cystitis. While not strictly types, emphysematous cystitis can be classified based on severity and extent of gas involvement. Mild cases might involve only the bladder mucosa, whereas severe cases can involve the entire bladder wall and even extend to surrounding tissues. Treatment strategies are determined by the severity of the infection and the overall health of the patient. Uncomplicated cases may be managed with antibiotics targeting the causative organisms. Fluoroquinolones, cephalosporins, and carbapenems are commonly used. It is also very important to drain the bladder through catheterization, which helps remove the infecting agents. Severe cases may require more aggressive interventions, such as intravenous antibiotics, bladder drainage with a Foley catheter, and potentially surgical debridement if there is tissue necrosis or complications like bladder rupture. Underlying conditions, such as diabetes, must be carefully managed to improve the outcome. Supportive care, including hydration and pain management, is also crucial. Can we prevent emphysematous cystitis? The best approach is to address the underlying risk factors. For individuals with diabetes, maintaining good glycemic control is paramount. Proper hygiene practices, adequate fluid intake, and prompt treatment of urinary tract infections can also help reduce the risk. For patients with urinary retention, intermittent catheterization or other bladder management strategies can be considered. What's the outlook for someone diagnosed with emphysematous cystitis? The prognosis largely depends on the severity of the infection, the patient's overall health, and the promptness of treatment. With appropriate antibiotic therapy and management of underlying conditions, most patients recover fully. However, severe cases can lead to complications and, in rare instances, mortality. Recent research focuses on identifying the specific virulence factors of the gas-producing bacteria and developing more targeted therapies. Studies are also investigating the role of novel imaging techniques in early diagnosis and monitoring of treatment response. Furthermore, newer treatment strategies, such as hyperbaric oxygen therapy, may improve the prognosis of patients with emphysematous cystitis. The future likely holds advancements in diagnostic tools and treatment modalities, leading to improved outcomes for patients with this condition.